everybody. Welcome to Seychelles Roundtable discussion. Today we are going to be talking about, we are going to be busting some popular Botox myths. So there's a lot of misconceptions when it comes to Botox, so we just want to set the record straight. So our first myth of the day is...
The first is Botox is toxic and nobody knows the long-term effects. Actually, Carly, Botox is a neurotoxin derived from nature, from Clostridium botulinum. It is natural, and it actually has been around in use since 1980, and it's used cosmetically like we do here, and it's actually used medically in very large amounts, so it is actually very safe for you.
So myth number 2, Botox will give me a frozen or expressionless look.
So that's actually not true because you can really tailor it to the way that you want it. So if you have a very experienced injector like ourselves, you can actually get very natural results where you still have movement in the areas that you want it, and you don't have to treat every area in the face. So very tailored to each individual person, and you do not need to look frozen at all.
Myth number 3, if you stop doing Botox, will wrinkles get worse?
Actually, they will not get worse. So your muscle is only going to go back to what it was at previously. Now, if you stop getting Botox, it might work that. If you stop getting Botox, it might look worse to you because you're used to having nice, smooth skin, but it's not going to be any worse than it was before you started because your skin or your muscles are only going back to where they previously were.
The next one is Botox will erase all of my wrinkles.
Okay, so it's not going to erase all of your wrinkles. You actually have 2 types of wrinkles. You have dynamic wrinkles and you have static wrinkles. Dynamic wrinkles are the wrinkles that happen when you move your face. That's why we always have you make those movements in the chair. We have you lift your brows, do a big smile. The static wrinkles are the wrinkles that are there permanently, the ones that have become etched. We can help you with the static wrinkles. The dynamic wrinkles you're going to do because you're going to move your face. And if they get deeper and more ingrained in your face, there's other options that we can start to look at. Microneedling, some lasering, some fillers. But that's the answer to that one.
Okay, so the next myth is Botox will work right away and is permanent.
So it does take Botox 2 weeks to fully kick in. Now you will notice over the 2 weeks that it will start to slowly kick in. So it's not like you wake up at the 2-week mark and bam, it's all of a sudden kicked in. It's going to slowly work over the 2 weeks. At 2 weeks it's fully kicked in. Now it does last 3 to 4 months. So it's not a permanent solution. We're going to be seeing you about quarterly throughout the year.
So that's why it's really important for you to keep your 2-week follow-up, because that's the only way we'll really know whether you need more or if you're good. Exactly.
Mm-hmm.
Another myth is, am I too young for Botox?
So the age that we start treating Botox it's FDA approved for age 18 and above. That's not to say that you have to give it at 18, but I do see a lot of young adults in their 20s starting to get it. It's for preventative maintenance. It's became very, very popular in that age group. So really, as long as you're over the age of 18, you can get Botox.
They gave this to me on purpose because I'm the scaredy cat. Botox is painful.
Actually, we use very tiny, fine needles, as you know, because you've done it and you've done well. It's not painful. It can be a little mild discomfort, but it's very short-lived. And as we all know, the result is worth it.
So worth it.
For sure.
Mm-hmm. So join us next time when we do a roundtable with some of your favorite questions.
Have a Seychelles day!
Seychelles day!